Okay, let's talk about side effects to treatment. The radiation does cause damage, really, to the mucosa of your mouth. And so you can expect after about 2 weeks of treatment that you're going to start feeling some changes in the way that your mouth feels. And it usually starts, it's just a little bit sore, and then it gets progressively sore as you go through treatment. You may feel some, you'll see some white patches in your mouth, and that's perfectly normal. That's just your mucosa responding to the radiation treatment. We have a new way of treating this. We used to have a lot of people experienced a lot of pain with the mucosal reaction of their mouth. Now we use a drug called gabapentin, which it works by your nerves come together, and there's a little bit of a gap in between the nerve fibers. It's called a synapse, and the nerve impulse has to jump over that synapse in order for you to be able to feel pain. And Neurontin acts by blocking that synapse so that the nerve impulse can't go over to the pain receptors on the other side. So you have the same kind of reaction in your mouth, but you don't feel the pain. And so after your first week of treatment, we start you on this drug, which is you start by taking 2 capsules at night before you go to bed for 2 days, and then you go up. We give you an escalating dose, and we're going to give you a whole piece of paper that tells you exactly how to take it. But over the course of about 10 days, you're going to get to taking 3 capsules 3 times a day. So you'll be taking 9 capsules a day. And at first, it can make you feel a little bit groggy, but that goes away over time. So we have you started on Friday night so that you have the weekend to kind of accommodate to taking the drug. And then usually by the time you come in on Monday, you feel pretty much back to normal, and we start escalating the dose. This is a very important drug for you to take, because in the past we had to use a lot of narcotics in order for people to be able to feel comfortable as going through treatment because of the pain. And now we're actually not even having to use narcotics very much, and we usually only use it at the end. And what that does, it keeps you from having side effects from narcotics, which can be nausea, constipation, sleepiness. So by using the drug called Neurontin, we're able to actually decrease the side effects to treatment. And when you don't feel the pain, you're able to swallow, so you can eat more and more often. The way that you help also, besides the Neurontin, the mucosa stay healthy is by doing mouth rinses. Keeping your mouth very clean during treatment is extremely important. So what we recommend you do is we're going to give you a bottle of this saline, which is really just salt water, and you're going to add a teaspoon of baking soda to it. And this is, we've done a lot of studies on what's the best rinses to use in your mouth, and this has actually been proven to be the most effective one that you can use, and it's also very inexpensive. So you're going to use this, you're going to put the teaspoon of baking soda in it, you're going to shake it up and let it dissolve, and you're going to gargle and spit with this solution 4 times a day. So you'll do it 4 times in the morning, 4 times in the afternoon, 4 times in 4 times at lunch, 4 times in the afternoon, 4 times before you go to bed, and that's going to keep your mouth really clean. When you finish this bottle, just put tap water in it, and put a teaspoon of salt and a teaspoon of baking soda, and just keep refilling it and using it. You can really use it as much as you want, because it doesn't hurt anything. It can only help things. Another side effect to your treatment is that your saliva is going to change. So when we treat, there's hundreds of saliva glands in your head and neck, and then they have some really big ones and some really small ones. And what we know is that the ones that produce saliva that's very thin are affected by radiation at first. And so what results is the saliva glands that produce the thick saliva continue to function, while the ones that produce the thin saliva quit functioning. So you're left with these really thick, tenacious secretions. So once again, the first 2 weeks you probably won't notice a change. At about week 3, you'll find out that you'll notice that you have saliva in your mouth. You always do, but you don't really notice it. But once it becomes thick, you begin noticing it. And then as you get nearer the end of treatment, sometimes it can even be hard to swallow. The saliva is so thick. after the saliva gets thick, then you stop producing it at all, and your mouth becomes very dry. And you're going to find that you're going to be carrying a water bottle around with you and having to drink much more. What you also probably don't realize is that saliva helps you propel and get the food down your throat. And so as your saliva becomes thick, it's harder to eat. And as your saliva mouth gets drier, you're not able to eat foods that you normally eat, like bread and crackers, because the saliva isn't there to lubricate the food and help you get it down. So you'll find that you're going to need to eat foods that are moistened beforehand, like pastas, macaroni and cheese, omelets. You're going to be adding gravy to your foods to help it go down. Your saliva does come back, and because of the treatment that we can now provide with it's called intensity modulated radiation therapy, we're actually shaping the beam that's coming in. We're able to protect a lot of your salivary function, your saliva glands. So after a month or so after treatment, you're going to see that your saliva is coming back, and that, after 3 to 6 months after treatment, your saliva is usually back up to about 60 to 75% of its normal, what you normally have, and you're back to eating normal foods again. Another side effect to treatment is called dysgeusia, which means that you lose your taste. Some people lose their taste after the first 3 treatments. Other people don't lose their taste until like 3-4 weeks into treatment. But it's a very disconcerting, side effect, because you really enjoy tasting your food, and when you lose that taste, a lot of times you also lose the desire to eat. And this is not a good thing for you, because we want you to keep eating as you go through treatment. So you kind of have to remember what food tastes like and make eating a job instead of a pleasure, because if you do taste, you usually just taste metallic. And this taste, it goes off, you lose it slowly, and it also comes back slowly. So you may find that a month after treatment you still don't have taste, but then it starts slowly coming back after that first month, and usually by 3 months you're tasting most things, and by 6 months your taste is almost normal. When it's very, very important for you to continue to eat through treatment, and the reason why is because the muscles in your neck, if you don't use them, there's a certain kind of muscle that they become very weak. And once they become weak, it's very, very hard to get those muscles to get their tone back. And so if you decide, I can't taste and my saliva is so thick that it's difficult to eat, I'm just not going to use those, I'm just not going to swallow, what happens is that you lose the ability to swallow long term. And our goal is, after treatment, to get you back to leading your normal life as soon as possible. So we need you to really swallow as you go through treatment. It doesn't matter whether you can taste or not. Think about swallowing things that have some sort of texture to them, some thickness, like yogurt or mashed potatoes, something that you have to use the muscles in your neck to swallow, and you need to do that every day. The speech and swallowing therapists are going to give you exercises to do, and they're going to tell you to do them 4 times a day. We need you to do them 4 times a day. We're looking long term. Even though you're going through treatment and that's your focus, we're looking beyond that, because we want your quality of life to be what it was before it started treatment. And for us to be able to help you with that, you have to do the exercises and you have to eat, even if you can't taste and you don't enjoy it, or even if it's slightly painful. It's important for you to swallow. We will be checking your swallowing reflex almost every week as you go through. We'll be putting a scope down there. And if ever we think that it becomes a little bit too difficult for you to swallow, we will tell you. And that's when you'll start using your feeding tube. Eating also provides nourishment for you, and it helps you heal. So those nutrients you need to be taking so that your cells that we're damaging with the radiation are able to heal. It takes a lot of energy for you to go through radiation, so actually the amount of calories you need to take in is greater than when you aren't going through radiation. And it's really hard to keep up with the calories that you need to eat. And that's why if we are putting a feeding tube in, that's why we're putting the feeding tube in. So once you start to lose weight, and we'll be checking your weight at least once a week, and once you've lost about 10% of your body weight is when we encourage you to start using your feeding tube. And at that time, we'll set you up with a nutritionist who will order the feedings for you. You don't put regular food in. You only put the food that we give you to put in. They'll deliver it to your house, and we'll teach you how to use that. So you don't need to worry about that now. It's just something to think about that may happen, and if it does happen, it's perfectly normal. We're just trying to keep your weight up as you go through treatment. You also think that when you lose weight, you also lose weight in your head, your mouth, and your cheeks, and that makes your mask a little bit loose, and we don't want that to happen. That's another reason why we keep your weight up. So far we've talked about losing your taste, having mucositis, and also thick saliva. Another side effect to treatment is that you may get a sunburn. Looks like a sunburn on your skin. It's a skin reaction to the radiation. We totally expect that to happen. It starts out by, you might notice that your skin's getting a little bit darker, and then by about week 4 to week 5, it may get actually red and can be a little bit sore. And at the end of treatment to after treatment, you may find that the skin actually peels off, and it becomes just like a sunburn would when it's sore and it's open. One of the things that we ask you to do to help with this is to use Special Care Cream, and you can start using that now to get your skin ready. It's got aloe vera in it and some vitamins just to help keep your skin soft and lubricated. You'll put it on the areas that we're going to be treated. So usually it's between, you start about here and you put it all the way down your neck, all the way around. And you're going to put it on twice a day, once in the morning and once at night. We do not want you to put the skin cream on 2 to 3 hours before treatment. So if your appointment, say, is at 10 o'clock, we would want you to put it on at 7, or we'd want you to put it on after treatment. When your skin becomes raw and open, if it does, we'll give you a different cream to use. And if you have a pretty brisk skin reaction, we'll be watching it every week, and we have all kinds of ways to help your skin stay comfortable during and after treatment. You may also find that the side effect of skin reaction may happen even the couple of weeks after treatment, and might even get a little bit worse. Okay. Those are really the main side effects that have to do with radiation. The thing that we need for you to do is to do kind of follow the recommendations that we give you. So it's a full-time job almost to go through radiation for head and neck cancer. You're going to be doing your mouth care, doing the swishes and spits 4 times a day. You're going to be putting on your skincare creams. You're going to be eating. You're going to be doing your speech and swallowing exercises, and you also need to hydrate. We want you to drink about 2 liters of fluid a day, and it's any fluid that you want to drink except those that have caffeine. You can have decaffeinated coffee, you can have decaffeinated tea, for those to count into the 2 liters. Now, if you want to drink coffee, that's fine. It just doesn't count into the amount of fluid that you need to drink every day. So by doing all of these things, and we'll be helping you, reminding you every week to do all of these things, the time after treatment you should be able to get back to your normal healthy self quicker, or more quickly, by really kind of helping us take care of you as you go through.